Now, we made a video where we spoke about the major equipment that you could see in a radiography laboratory. We mentioned them, we listed a lot of them and all of that. So here we're trying to look at the accessory equipment. So accessory equipment is more of like things that are needed. Do you understand? Extra things that you might actually see in a radiography department. So the main aim of this lecture is you try to list this accessory equipment, the different examples. Then by each example we're trying to list, okay, what is the use. Okay, so accessory equipment for radiography include, they are just supportive tools. They are not like the main tools, you understand. So they are actually used alongside the primary imaging tools. So the supportive equipment, mainly maybe you just want to arrange how the patient is positioning. You just want to like use them to reduce the radiation intensity, so that it will reduce the amount of radiation energy that is getting to the patient. All those things, they are just to help, okay, protect from radiation and also make that the imagings are of high quality. So for the different categories of accessory equipment in radiography, we have all those patient positioning aids. So all those things like sponges, foams, blocks. Okay, I saw one here. Okay, you can see. Okay, lead intensifying screen. It's not this one, all right? But there are some foams that, let me say something that's like this. You can put it under your leg if you want your leg to be up. All those kind of things. We have sandbags to reduce movement and help to maintain posture. We have the Velcro straps and compression bands. They also have all those headlamps and immobilizers, things that can help to like hold your hand in one place or hold your head in one place, just to make sure that the parts that they are imaging is in one place, so that the image is not fuzzy. Okay, so radiation protection devices, these ones are all those things that you are using to like reduce the amount of radiation energy that is getting to the patient. Okay, so you are using it for patient-centered care. So in as much as you want to get the best imaging to aid you in diagnosis, you are also making it that, okay, this patient is not suffering from too much radiation. So all those lead aprons and shields, thyroid collars, lead gloves, mobile barriers. Then we have all those image quality enhancers, like all those grid, the filters, the collimators. Those ones, they restrict the beam size to reduce too much exposure to the radiation energy. Then we have all those contrast and injection accessories. When you want to image a particular place, you give in contrast so that it improves the quality of the image. So all those contrast media injectors, you have this gadolinium, have the iodine based contrast. We'll get to talk about them as time permits. The intravenous stents and syringes, pressure modifiers. Then we have all those things for patient comfort and also their safety, like the blankets, the padding, the wheelchairs, the stretchers, emergency equipments like oxygen masks, suction units, crash carts, The specialized accessories like all those cassettes, CR, DR holders. We have the markers, we have the positioning stands, then also immobilization devices, okay, for pediatrics. Okay, so these are the various things we have, and we call them the accessory equipment because they are not actually the primary x-ray machine and the rest of it that we use for imaging, but these ones, they just help to make the whole process very much more better.